Well, thank you for joining. As has been explained, I'm Katie Cardarelli, operations at Parlance, joined by Valerie. We're going to take you through our collective journey for implementing IVA together, and hope you can get something out of it, and hope we have a nice discussion as we finish our presentation.
Okay. So just a little bit about who we are. We are a multi-site practice group in Virginia and the Central Virginia area. As said, we have primary care, we have walk-in cares, immediate care offices, we have an independent lab, we have occupational health, we have specialty services, and pediatrics. We use Athena EMR, so it's very important to us when we use a platform that it does integrate with Athena for ease, and then we use Privia Health for our practice management. So this is just a little footprint of who we are. This is how many unique patients, physicians, APPs, diagnostic exams, which will grow this year. We were able to add CT and MRI, which is nice. We do over 1 million lab visits in our main lab, over 300,000. Right now we have 15 active Parlance locations, and we're adding another one at the end of this month. It's the final one that we want to add. 300,000 annual patient visits, and here's our biggie. Our annual phone call volume was 400,000 plus. In implementing this system, we were actually able to take 30 dedicated phone personnel and reduce that to 21 by attrition. Openings in the organization, team members could move from one to the other, and it really helped us a lot for our satisfaction. And across the board, we have 383 employees outside of our 112 physicians and APPs. This is our mission statement. We, keep it short and simple, helping people attain better health for a better life. Very family-focused, patient-centered organization. You can see our vision statement, but the biggest thing we live by is these core values, and everything we do is based on these core values. Excellence, professionalism, integrity, compassion, and teamwork. And we have these defined for our teams so that they absolutely understand that everything they do every day falls under one or more of these categories. So, phone wait call times. This was our #1 patient complaint on our surveys, every survey, every quarter. We have offices that had up to a 30-minute hold time. And for that was just unacceptable to us. It causes a lot of stress for the patients and a lot of angst for our team members. Once the calls got 20 or more in queue, they went to a voicemail that, how many of you have ever put some type of workflow in your office and somebody's not following it? Or does everybody follow your workflows? So this was a gap in the voicemails that were being left. And we actually had patients driving to the office, and they would be on their phone saying, okay, this is old school phone, let me do this. They would walk in and say, I've been on hold, and I drove here 15 minutes, and I'm still on hold. So we really knew we needed to find a solution for access for our patients. So the biggest thing, the most important thing, I want you to raise your hand if you have that champion site. Your leaders are great, your physicians are great, and your team members are great, and they're your go-to for any pilots. Who has that? Like to see more people raising hands. Do you not have any pilot offices? I'm so scared. So we chose that site, and the big thing was too is because that was primary care, and that's the majority of our business. We were able to model all the subsequent go-lives against that model that was already set up, which made life a lot easier. And then as we brought our specialties on, we could add or subtract as needed. So we did cluster the similar practices together in our go-lives. And really important, between our first go-live and our subsequent ones, mainly due to us, not Parlance, we had so many projects going on. There was a 6 to 8 month gap. We did a phased implementation. We first rolled out the FAQs and checking on your appointments, and then we added the schedule, cancel, reschedule, messages going to the staff as needed. So we had that 6 to 8 months. If we hadn't had the workbook they provided and the lessons learned, we would have had to drop back and punt, and go all over again. So this was helpful for us for a refresher and to keep that.
Yeah, and I would say going back to kind of the problem that they wanted to solve, that was the same question we were asking once we got in and started that partnership, right? The first question we asked was, why are we here? What is the problem that we're trying to solve? And that helped us kind of steer and guide the solution. That we had all of the tools in our tool belt, but which one did we want to pull out first so that we could start to see immediate relief and immediate return on investment for what they had purchased. And we were able to do that within that first pilot site, just by kind of releasing the pressure valve at the front door. Parlance has done routing and kind of front door forever, but those other tools we were also learning at the same time. And so we were able to really work well together and build that kind of front door success and then add on as they were adding on.
And one thing I will say that was nice about that, a lot of times you work with a partner and they can't give you any solutions. And so we would come to them when we were at the table saying, well, what have other practices like us done? And it was really helpful to have that feedback to say, yeah, we like that, or no, maybe we can tweak it this way. So that was very helpful. Wow, so lessons learned along the way, which we'll talk later. One of the biggest things that we dropped the ball on ourselves when we were doing this is not getting our telephone vendor on board from the go live. So we're ready to go live and we're getting them on board and realize that we should have done it sooner. So after that first go live, everything ran smoothly after that. So get your key people in place from the get-go. Also, if you're going to have key people in place, let them be involved from the get-go, because there's nothing worse than trying to catch somebody up on a project that they need to be involved in.
Absolutely, absolutely. I think obviously having the data as clean as possible, getting that over into our hands earlier, and we learned that kind of through those subsequent go lives. Learning more about the scheduling types, the block types. Are you open scheduling? Are you already scheduling online? Can we take some of that online scheduling functionality and turn that into work that can be leveraged in the voice channel? Is something that we were able to do in this case as well, to speed things up, to get that delivery faster and the return faster.
And I heard someone's, I've heard it said earlier, they can't manufacture what we don't have. So you have to have the appointments available to be able to reschedule and schedule appointments. And so we really looked at what are our barriers to our scheduling. Are we too pigeonholed on where we're putting a patient for a wellness or for a procedure? And so we championed across the board similar template. So everybody's on the same type of template and it's open. You either want a 15 or a 30-minute appointment, and this is what we do. And it's helped really our access a lot.
Absolutely, absolutely.
These are some kind of funny things that we went through on here. Has anybody ever seen the little meme or the little video that the dad asked his children to write instructions for a peanut butter and jelly sandwich? And they bring it, and it's just abysmal, because there's a lot of things here that don't go on paper. And so we brought all these people to the table. We brought IT, we brought clinical, we brought billing, we brought front. And none of us at any point in time thought about these two things. After hours, do you have on call or not? And what's that look like? But the first snow day, and I have to say they were on top of it, when we altered our hours, we're like, we didn't build this in. And anybody that's lived in this coast knows that this January was really horrible. So that was a lesson learned. Accent and dialect. I'm from Kentucky, and I really tone down my speech when I'm talking to people. But having a lot of people across all of our offices that were going live to do the testing helped them do the buy-in, but also the accent, because they took no as no. No, no. So think about some of those. And the bot they have now just gets that, and they understand that, which is really great.
Yeah, so we're talking early 2024 testing. We go to do our first round of user acceptance testing, and it comes to a screeching halt. And we're like, what's going on? We just passed it over. It passed our internal testing. What's happening? And obviously, yes and no, affirmative, like these are important responses for testing, and they're catching their no as K-N-O-W in the text-to-speech translation. We were able to quickly fix it, but again, something that we wouldn't have caught otherwise until we handed it off. And like Valerie said, the 2026 version probably wouldn't have behaved that way, but that's part of the partnership and part of the learning, and it makes for a good story now.
Oh yeah, and then Katie called me one day and she said, I'm trying to schedule for this particular doctor and there's no slots. And I'm like, what? And I'm looking, I'm like, she has slots. Well, I found out that her particular care center leader was managing appointments instead of stamping the templates, which doesn't show the availability. So we worked through a lot of things on that.
Absolutely.
Can you go back one thing to the treating the IVA as human?
Yeah.
Just to make sure and understand that as we go along, our patients are kind of learning the things that they need to go. We have chosen for after hours for certain things to come to us because we want to make sure we're triaging those the way we want to triage them. And for our patients who, we've been around for 33 years, and some of these patients have gone from birth to, up in the 65s, have seen this. So we wanted to keep that personal touch. So we let everybody know, when you're getting these messages right now, it's going to be what the patient says until we can start asking them some cues.
Just wanted to talk a little bit about the partnership. Talked a little bit already about the value of the partnership, but really for us, a lot of this technology is the same, right? We have a lot of colleagues and partners here today, but what we really want to highlight is that the partnership with our partner is really what makes it different, and that we're building the asset together, right? What makes a really special product are those lessons learned and the discovery that we're doing together. Making sure that if we have a low utilization rate for scheduling, that the customer understands that there could be a number of different things going on, and that we have the opportunity and the touch point to say, do we have the access to the right appointments? Have we cut down the scope of this scheduling too small? And are we really making the most of leveraging the technology the way that it should be? We also have obviously been in the voice space for a really long time, so providing best practice and coaching on what might look like to marketing a beautiful opening greeting or text, but we know it's way too long and that people are going to abandon during that opening greeting. And so there might be ways to work in that language in other spots in the dialogue. But for us, it's really about bringing these people to the table, making sure the experts are at the table and that we have those supports along the way. We were implementing another IVA at the same time for an organization that takes 7,000 calls a day. And compared to our partners in Northern Virginia, that's a very different size, but everybody gets the same amount of treatment. All customers are treated the same and deserve the same amount of coaching, support, and personalization when it comes to the product that we're building with them.
I have to say, I think we've all worked with vendors and with partners that it's crickets. You sign the contract, and there's no help after that. I've actually changed vendors because of that in the past. But what I have found with your team is that the availability is always there. If we say that we want to change something because we didn't do something in the beginning, it happens right away. And that's really huge for us because when those problems arise, you want to take care of them and find a solution for them as soon as possible.
Yeah. Absolutely. And they lead the way with that patient centricity, and so we try to take their lead. We have a patient-centered solution that takes kind of and follows the culture that CVFP has set forward.
Yes.
Yeah. We talked a little bit about this, but making sure you really understand the solution that's already in place and how it's functioning within the complex system that you're putting it in, right? None of us here that are in the vendor space are putting these solutions on top of something that is cookie cutter, right? These are really complex systems. There's a number of different things at play. And so making sure that we really understand the other things that are within that mix and how our solution fits into that. And really remembering what you're solving for, and that's removing friction for the patient and providing options and providing solutions to augment that human experience when that's what the patient needs.
And when you speak about options, that's really important because, most of us, we have an EMR, you have a patient portal. What's your utilization on your portal? And some people like that. So we like to give options. So you can call in if you're up at 3 a.m. and you want to cancel an appointment or reschedule or make an appointment, you can do that. We try to do things that are open-ended. This is a 24/7. You can call in anytime you want, even if it's after hours, and take care of these solutions that you need. Some people may still choose to communicate via portal. Some people may communicate here. And so we just like to give people options because everybody has a preference on what their communication style is. I've heard communication here a lot, and that's, I would say, like, who puts out what they think is enough communication and they still hear from their teams there's not enough communication? So we try to look at internal communication, but we also need to do that external communication for our patients. What we did for each office as they went live is we did an email campaign through our partner with Athena, and we looked at who was going to be seen in the next 90 days. These are most likely the people that are going to be calling to do something with an appointment, find out your location, or ask some questions. So we sent a blast to them, and it really outlined what this can do for them and what the advantage was for our patients. And so if you're used to pressing 1, 2, 3, and even when we were testing, it was like, how can I help you today? That open-ended, we're like, so it just helped our patients know what they were going to hear when they called into our offices. And then I think that really helped, and we didn't have as many abandoned calls as I think we would have. And then choosing that pilot site. All of us, I've heard, we have leadership meetings, we have focus groups. So we chose a site that the physicians and providers who were a shareholder company that are working with their team members, that their leadership and their teams really had that buy-in, and they wanted this because they knew that we had an issue that we needed to take care of. They heard the complaints, they wanted to solve it. And so having them do that and then speak to the next ones that we brought live, because we would bring everybody together as a group, was so helpful to have that champion and to have that positivity, because change is hard when you have to do something new. We all know that.
Absolutely. And I think the patient population who's used to waiting 30 minutes for someone to answer the phone is quite shocked when you turn something like this on and you get a voice that says, how can I help you, on the first ring? And so you need to prepare that group of patients to say, here's what you're going to hear and here's what you can do with it to make sure that you're making the most of the tool that you've built and the tool that has been built. And so I think the communication through those waves got even better. We did a decent job the first time, and then as we went on, we gave examples about the things that you could say to get the most out of that experience, right? These are the types of things that you can do with this virtual agent that you couldn't do before, and that you don't need to wait for, that you can do for yourself, that you could do 24 hours a day. And there's a lot of value in releasing that appointment at 3 a.m. It's now available to someone else to schedule in the morning. You no longer have to wait. If somebody cancels at 8:01 for 8:30, that appointment's not usable. Nobody's getting there for that 8:30 slot. If they can cancel it overnight, there's more time to fill it.
Yes, and the IVA voice, the first voice we had, we loved. And within a month, they were like, hey, we have this new voice, and it was great. You wouldn't know that it's an IVA. And the funniest thing happened the other day. I wanted to call an office. I always like to test our systems. So I get on there, and it used to be press 3 for doctor's line, right? So I called, and it said, how can I help you today? And I'm in the middle of doctor's office. This was the most real thing I've ever heard. It was like, it said, are you a patient or calling from a doctor's office? The question was in the tone, and I was pretty impressed with that.
Sounds good.
Yeah. So one of the things that was really great is we've looked at a lot of vendors and a lot of partners that is kind of an all or nothing. And so we've been able to customize what we use from Parlance in each of our locations. So for our primary care, we want the whole 9 yards. Scheduling is much easier. Everything is just full. For our specialty offices, we're working on, there's a lot more that goes into seeing behavioral health or seeing a sports medicine doctor. And we're working on, with them, being able to delineate that to get those schedules. So for right now, we're doing the FAQs and routing as needed, and it's the same for our diagnostic. But we're going to move those into those phases. We just have so many projects going on right now that it's on the back burner till Q4. So, yeah. It's great to be able to do that.
We're ready when you are.
This was our solution. Our patient satisfaction surveys regarding phone access improved by 65%. I mean, that was huge for us. It used to be the #1 complaint. Now it doesn't even have an honorable mention, which is really great for us because then it really allows us to focus on perhaps what else can we improve on now. And we're always looking for that. Patients can self-serve after hours. You know, you're working, we're all working 8 to 5, and who has time in their day to make that call, change that appointment, get that, oh, where's the office moved to, and get that information at your fingertips. It's really huge. 75.3% of year-to-date calls have routed or self-served instead of waiting in the queue. And that's really huge for our organization. So that's taken a 75% burden off of our team, which is really helpful. And we only have 8.7 hanging up in the first 15 seconds, and I think it's still those newer ones, and we want to do a reach out campaign again on this, that when they're used to press 1, 2, or 3, and they're getting, how can I help you? They just, hang up. So doing that. You can see here how many patient messages were routed to the care teams. Again, our choice to have that done. 11 FTEs reduced through attrition across patient services and scheduling. We had 2,089 appointment actions self-served by patients year to date without staff having to touch that. And that's just with our 8 primary care locations. Being able to do that appointment, schedule, and reschedule, which is why we want to move it to the others for efficiency. Our first work, it was 40 to 60 hours. It was because we have other projects. This wasn't our sole project. We had meetings with them and, put that in the schedule from the get-go, which was important, and really mapped out like 100%. And I would say I think the only thing we did miss was the after hours and snow and alteration to hours. So that I think that was pretty good. Then after we did that, it was like boom, boom, 2 to 4 hours, plug and play basically. Yes, these officers are the same. You just have to change the routing on their end, which was really great. How many of you in your life have ever worked in retail, grocery store, cashier? Do you know the angst of it's the snow and you're a grocery store cashier and the line is clear down there and you've got that angst because you can see all these people in line and you're trying to check them in? This is the angst that your team members feel when they have 20 calls in queue. It's stressful for them and they feel like they can't take care of those patients as they need. This has really helped reduce the wait time, but patient satisfaction was great, but we have to think about team member satisfaction as well. And so this reduced a lot of stress. And the other thing is too, for those messages that we do have to handle, I'm not taking those calls from 8 to 10 on a Monday morning or right after lunch. I can at 10 o'clock start returning some of these calls and finding out the information I need. It's allowed us to better manage our day. Front office operations, I think a lot of people don't realize everything they do. I think everybody across the board does a lot, but this has really helped our teams. And it's also helped our clinical teams with getting those messages in for things patients need without having to talk and ask and query. They can just take care of it and send them a message.
Yeah, and I think it's probably worth kind of messaging from sharing from a technology perspective that the messages that are going in and being routed to the care teams are verified patients in the patient's Athena record. So it's no longer the voicemail that someone's taking and transcribing and sending elsewhere. They're actually sitting in a transcription and transcribed state in that patient's record. So you've reduced all of that administrative wait time, and now the action can be taken from there rather than being taken a few steps away. We already know who's calling and what they're calling for. So intent and verification are already done. So the next step for that kind of is where does that action go to next? And so now we want to talk about where do referrals go, where do refills go, where do med questions go, and so that's kind of where we go next with that intelligent rule-based routing for those messages.
Yes, and it's been fantastic, and the team loves it. We actually, I have my telephone numbers on a test patient that's called Valerie Test. And I got a call from one of the offices because there was a text message that I had been vomiting and had stomach issues for 3 days, and I got a call from the clinical team member who was so concerned about this, and they were like, "Valerie, is that you?" And I'm like, "Yes, this is Tess, but thank you for calling." And that was huge because now we have if you call me this morning, I need to answer you by noon. If you call me this afternoon, end of business day. So we like that 4-hour turnaround time, and this has really helped with that, 100%.
Absolutely. So kind of wanting to think about what you would take away from this conversation, or if you're heading back, what are the 5 things you needed to know? I don't think there's anything here that we haven't gone over, but I think documenting every lesson immediately was really big for us, and not just the lessons from our side and the lessons from their side, but kind of those co-lessons. We talked a little bit about the telephony integration. The telephony integration with 8x8 was not easy, and there was a ton of nuances. It was always like a plus sign or a 1 or a 2 that was getting in our way, but we wrote down those shared lessons every time, and then it was a different lesson every other time, but making sure that you have kind of that debrief after the fact and document those lessons so that you can make a new mistake next time, but not the same mistake that you made the time before.
And those first go live days, I want to say, they were available for us. We were like available all day long. But what I really love is there's a call before we go live, and we have our 8x8 vendor on the phone. We have 3 people from your organization on the phone, a couple people from ours on the phone, and it's just that checkpoint. Are the calls going where they're supposed to go? So that when the phones do come on at 7:45 or 8 o'clock, that we're ready and everything's smooth.
Yeah. And we'll live listen to those calls throughout the remainder of the morning, see how things are going, check in, and then we do that, obviously, throughout the course of the week.
Questions? What questions do y'all have? No one has any questions. I'm so sad. If there's anything you want to know about what our implementation journey looked like a little bit more in depth and what it has been like to work with Katie while she's not standing beside me, I'd be more than happy to talk to you. But I'll tell you the same thing that I tell you now. It's been a great journey, and we're always looking for ways to improve, which I know you guys are. And so this was just a solution to an issue that we had that has worked very well. Okay, thank you.
Thank you so much.